Yo guys, it's me, Princess Ricky. What's up? I just said it in a completely wrong order, but hey ho. And welcome back to Surgery Squad. Thought we'd do ingrown toenail removal because it looks pretty gross and grim, and that seems to be the ones that get the most views. I remember before they wanted me to have mine done, but I ended up having like a backwards ingrown one. So for mine it was ingrown right at the back. So in the end, I just cut off my nail and it grew back. But I was terrified letting her do this because it doesn't grow back after because they put some solution on your nail bed. And oh no, I couldn't walk around without a nail. Like my OCD would just be like, no, don't do it. Come on, load it then. Load it. Load it. Load it. Come on. When are you loading? Load. You can see I'm pressing start. Yay, I done it. Now we load. Alright, let's see what gross thing we're doing today. Surgery Squad.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I will be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately. Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one. Our patient is ready, so let's begin by disinfecting the toe.
Residents' feet nails, but we're allowed to do hand nails. Alright, click and drag. In the name solution to continue, okay? Is it working? Am I dragging? Oh, yeah, I remember this doesn't work right, does it? Because I'm on a sensor pad, not a mouse. That means I have to click there, I think. Did I do it last time? But come on. I hate feet, so I don't even know why I chose this video. Come on. Do it. Do it. And do it. Ricky, do it. Ricky, no, do it. Remember before it was like I had to... Come on. This isn't working. Come on. Come on. Oh. You can do this job, Jeff.
Now, we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Where do you want it? Around the... Oh, okay. So you want one here. Are you bleeding? Where's the big one? Is it there? Tapping on this works.
Great! Now we'll wait a few minutes for the toe to get numb.
Bye.
Now that our patient's toe is numb, place the special tourniquet around the toe.
I know what this is.
This will help reduce the amount of blood coming from the wound. Once you've done that, we can move on to removing the ingrown portion of the toenail.
I know what it does, Jeff.
First, carefully slide one blade of the nail anvil under the affected nail.
No, you do it. I'm so sorry.
We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
I'm sorry. Oh. I'm sorry. Oh.
Great. Take the forceps and carefully remove the ingrown nail.
No, you do it, Jeff. I don't want to do this. Why did I choose this game? Alright, so I've got to drag this way. It's easy to seem to work when I'm tapping, so maybe if I tap and do this? I really need to buy a mouse pad for this. It's that USB one. So I can do tappy stuff, it's just not letting me do this. Give me a second, I've got an idea. I'm trying. It's like, I don't want to move the screen. Oh.
It's getting kind of messy in there. Let's clean up that blood.
You do it. I ain't got gloves.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge of the toe to get as much of that infection out as you can.
Oh, you do it. Stop making me do all your dirty work.
That toe is starting to look much better,
No,
but we're
it's
not
not.
done yet. Next, we're going to apply some phenylacid to the wound. This will help ensure that the problem of ingrowth will not reoccur in this toe.
This stops it from growing back.
When you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
You can't just leave them with half a toenail.
Finish by applying some antibiotic ointment on a sterile gauze pad. Place it against the toe and wrap it in a gauze bandage. Fantastic job! Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper-fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today.
I know I did.
While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
I've just found another link, Jeff. Give me time. We'll do breast implants. Do it so you guys can see. Should be able to see. Yeah, you guys can see. Let's give this person some boobies.
Welcome to Surgery Squad's virtual breast enhancement surgery with silicone gel implants. I'm Dr. Susie, and I'll be assisting you with this procedure today. For those with a weak stomach or have children in the room, I need to let you know that the next few steps get a bit graphic and contain nudity. This procedure may not be appropriate for work or school environments. Click the continue button when ready.
Better? You can hear Susie now. Alright, I'm coming up, Susie.
Breast enhancement surgery, also known as augmentation mammoplasty, involves increasing the size or changing the shape of a woman's breasts through the placement of silicone implants under the breast tissue or under the chest muscle behind the breast. The surgery can give a woman fuller breasts or restore breast volume lost after weight reduction or pregnancy. It is also done to equalize breasts that are different sizes or as a reconstruction after breast surgery, such as a mastectomy. Our patient has recently lost weight and feels that her breasts are now too small. She has chosen to augment them through surgery. She has spent time with her doctors to understand what is involved in the surgery, as well as the benefits and risks. Her surgeon offered a computer program that simulates what the patient would look like with different breast sizes. Use the slider to demonstrate to our patient what she would look like with different size breasts.
No. Drag to slider. Left. Oh, this slider.
It looks like our patient has chosen a size she likes. Let's put on our gloves and see what we can do. In order to make sure each implant is in the correct position, we must first mark the current top of the breast and where the midline between the two breasts is as well. This will help us when we position the implant.
Oh, Susie,
I've marked each of these with a dotted line. Can you draw them in with a marker?
Yep. Give me time. No, that wasn't what I wanted. But hey, you worked. I want like little eye. Oh dear, that doesn't look like an eye. An eye. Eh. Sorry, love. Then down here we do a little smiley face. Oh, it ain't working. Do a little smiley face. There we go. Then on to this one. An eye. Oh yeah, this one comes out neat. An eye. You can be a sad baby. A sad baby and we've got a happy baby. Now to do carry on the game properly. I am barely on the line. Sorry, Susie, you got a lot of cleaning up to do.
We need to measure the breast to decide where the top of the implant should go. We do this by measuring with the caliper from the middle of the areola. Draw with the marker at 12 centimeters to mark the top of the implant, and then draw the outline of where the implants are going to be placed.
What, so you want me to draw circles around your boobies now? Ricky, draw actual circles, don't do anything stupid. Come on, Ricky. Oh shit, my hand slipped. Ready for your neat one? Oh no, they're both done out shit.
Now that we've marked the patient, let's get her to the operating room. To begin the surgery, we need to start an IV to provide our patient with fluids and medication. I've already tied a tourniquet around her upper arm. Can you find a suitable vein in the patient's hand?
No. Susie, no, don't make me do this. I hate blood tests. And, no, something that involves blood. No.
That'll work. Sterilize the insertion area using an alcohol wipe.
Can I drink it instead? Here we go, love. You're nice and clean.
Insert the needle and advance the angiocatheter into the vein.
No, you do it. Please, Susie, you do it.
The small burst of blood that just appeared in the angiocatheter hub is known as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. Now I'll release the tourniquet. While applying gentle pressure over the vein to collapse it, you can remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed. Once you remove the needle, it will be properly disposed in a sharps container.
That's nice, but you do it. What?
I'll lock the IV tubing to the angiocatheter by rotating the locking mechanism. Lastly, we need to secure the IV with tape and test the line. Next, we'll use a chemical antiseptic known as chlorhexidine to cleanse the patient's skin. Use the applicator to apply the chlorhexidine to the surgical site.
Okay. Is it working? I can't even tell. Yeah, it's working. You're getting more white. You look like Michael Jackson. You were one dirty girl. There we go. Continue. Susie, I'm finished.
While some anesthesiologists may prefer to give a patient a general anesthetic using the IV line, we'll be administering it using a face mask. Once the patient begins breathing in the anesthetic gas, her bloodstream will absorb the gas and carry it to her brain. At this point, her brain will stop receiving signals from the nerves in her body, allowing her to be completely asleep and pain-free during the surgery. Start by placing the mask over the patient's nose and mouth. Once it's in place, we'll turn on the anesthetic gas.
1 second, guys. Just doing some. Alright. Oh god, listen to that thing on Monsters Inc. that they go to fit over Kimmy. I mean, not Kimmy, that's Rugrats. Night-night.
Now that our patient is unconscious, we'll insert an endotracheal tube into her mouth and down into the windpipe. This will help her breathe and provide a constant mixture of oxygen and anesthetic gases during surgery.
This is what I'm doing.
The incisions for breast enhancement surgery may be made under the breasts, around the areolas, or under the arm. For this procedure, we'll make the incision under the crease of each breast. This area leaves little noticeable scarring. Now sketch where we'll be making our incisions.
Alright. There. And there. Done, Susie.
Let's use the scalpel and make the necessary incisions so we can insert the implants. Our patient has chosen silicone gel-filled implants because they have a more natural feel. We'll have to make a slightly longer incision in order to insert the implants. This is due to the implants being full when inserted, as opposed to saline implants, which can be inserted empty. With our incisions made, we'll now make room for the implant. To do so, we need to slide a finger into the incision and gently sweep it back and forth to separate the pectoral muscle from the ribs.
You do it.
Using a finger is gentler than a metal instrument and lessens the chance for damage to the nipple's nerves.
You do it.
Can you slide your finger into the incision
No.
and move it back and forth to create the pocket for the implant?
No. But I guess for the sake of this video, I guess I have to. Go on. Oh, it's a big hole. Oh no. Make it stop already.
Now we carefully insert a retractor and cauterize any muscle groups still attached.
Okay. Oh, that's a big one. It's alright, like, shoving, like, finger up there because it's less, like, likely to do harm, but yet you shove a big metal thing in there.
Nice job! Now we need to prepare the implants. Breast enlargement is achieved through the placement of a silicone pouch called a lumen. The lumen may be filled with either silicone gel or saline. There are advantages and disadvantages to each type. Click each implant type to see the pros and cons of each.
First, the silicone breast implants maintains firm shape, resistance in ripping, collapsing, similarly filled natural breast cons, potential silent ruptures, silicone-related health issues, can migrams.
As I said, our patient has chosen the silicone gel implants. Unlike saline implants, silicone implants come pre-filled and ready to go. All we need to do is open the sterile pack and insert the implants into our patient. With our incisions made, we now need to slip the implants into the pockets we created under the chest muscle. We do this with our hands. Because the lumen is fully filled, it can be a little tricky to get the implant in place. As you tuck in one side, another will slide out. Can you use your finger to slide the implant into place?
No. But still, for this video, I have to.
Now we adjust the implant with our finger. Great! Let's do the other breast and then we'll check them for evenness. Our patient is still under anesthesia, but we've placed her in an upright seated position. This is so we can inspect the breasts for implant placement and evenness. We examine the top and bottom of the implants in the breast as well as the placement of the nipples. It looks like the left implant is a little higher than the right. Can you lower it?
No, but I guess I have to.
Perfect. Now we need to move our patient back to a flat position to prepare to close the incisions. With our patient lying down again, we'll inject some long-lasting numbing medicine into the incisions before closing. And we're ready to close.
Suture.
Excellent work! Breast enhancement is typically an outpatient procedure. The patient is released once she has recovered from the anesthetic. The patient is sent home wearing a support or sports bra. Her surgeon will offer additional advices as to when to wear this during recovery. Removable stitches are taken out after about a week. Dissolvable stitches typically disappear in about 6 weeks. When our patient returns home, she needs to ensure that she's following our doctor's recovery guidelines. Be aware that if the implant is placed under the chest muscle, limited activity will last longer. And there we have breast enhancement surgery using silicone implants. After our patient's recovery, she is happier about her appearance and is more confident in herself. Thanks for stopping by Surgery Squad. Why not check out one of our other great surgeries?
Guys, I'm just trying to see what other ones we got. We got how to cook a turkey. I don't get how this is surgery. But let's do how to cook a turkey. That's not what I wanted. I don't want to wait no dragon. How to cook a turkey. It's on Surgery Squad, so. Come on, you loading? I've got Flash. Flash. Ah. Savior of the universe. There we go. See you when Christmas is coming up. You guys should be able to see what I see. Yeah, you do. You see what I see? Awesome. You can skip this ad in 4, 3, 2, 1, 2, 3, 4, 6, 7, 8, 9, 10, 11. Press space. I press space, but it just takes me down the page. This is stupid. Whee! Okay, fuck it. We ain't gonna be able to do turkey. Actually, wait. I want to try something. Oh wait, I got it. We are doing how to do a turkey. I don't get why turkey's on this. Oh, I should get Cooking Mama. Might be better.
Hello, and welcome to Surgery Squad's Thanksgiving special, How to Cook a Turkey. I'm Dr. Jeff, and I'll be guiding you through this delicious procedure today.
Excuse me.
Nothing helps me relax more after a challenging day in the OR than cooking a fine meal, and I especially love doing it for family and friends at a big Thanksgiving dinner. The guest of honor at any Thanksgiving dinner is the turkey. Today, we're going to show you how to prepare, cook, and carve your bird to help make this Thanksgiving and others to come delicious and memorable. Just like we do for a surgery, we have to make sure we have all the tools necessary for the procedure. Here's what I use. A roasting pan with handles and a rack, good for catching drippings as the bird bakes, aluminum foil, a stick of butter softened at room temperature, kosher salt, freshly ground black pepper, and a meat thermometer. Before you cook your bird, you must make sure it is completely thawed in your refrigerator. Never leave a turkey out to thaw at room temperature, because that might cause bacteria to form. Our subject today is a 24-pound turkey who is nicely thawed and ready to be the big star. Can you pat the turkey dry with some paper towels as I remove the gizzards and neck from the body cavity?
Okay, what are we doing? I'm gonna wipe you. Hey, the turkey's nearly as white as me.
Great work. Let's wash up and get cooking. No matter what size bird you're working with, it's important to remember to keep it moist. If the bird is too dry, your guests might have to lie and tell you how delicious the turkey is, when they really wish they were eating a TV dinner. Here's how I prepare a turkey to keep it moist. First, rub the softened stick of butter deeply onto the turkey skin, which will make it nice and brown as it bakes.
Okay, I'm trying. You guys can see me dragging the butter, right? Come on. Work. 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 Done it. He knows.
Good. Next, sprinkle a generous amount of salt and pepper all over the bird for seasoning.
Guess we don't want anymore. Right?
Great! The bird's all seasoned up, but not quite ready for the oven. Some folks traditionally fill the cavity with their stuffing mixture. I don't, mainly because it introduces some problems. First, there's a chance that bacteria can find its way into the bird. Also, if you cook your bird to the perfect temperature, the stuffing will be too dry. It's best to bake the stuffing as a separate dish. Instead of stuffing, let's put in some aromatics, such as rosemary or sage, a stick or two of cinnamon, a whole lemon, onion sliced in half, or a handful of peeled garlic cloves. As the turkey cooks, so do these guys, and they'll release all kinds of flavors that will get right into the meat. This guy's gonna taste good. One more thing before we put it in the oven. Take a large piece of aluminum foil and form a tent over the bird. It will keep any moisture from evaporating. We'll take it off during the last 45 minutes of cooking so the bird can brown up. Ready for the oven? Okay, we've got ours preheated at 325 degrees. Generally, we'll cook a turkey at about 15 minutes per pound. Our turkey weighs 24 pounds, so multiply 15 by 24 to get 360. Then divide that by 60 to get 6 hours.
Come on, go in the oven. Done it.
All right, let's put the game on the TV and get ready to greet our guests. There's about 45 minutes left. Time to remove our foiled tent and check the temperature. Smelling great. There's some nice drippings in the pan for gravy. Everything seems okay, but let's see where we are with the bird's temperature. Most turkeys come with this little pop-up device that's supposed to tell you when your bird is done. Thing is, it's not always accurate. That's where you need the meat thermometer. It's going to give you the most accurate temperature. We're looking for a temperature of 161 degrees for the white meat and about 180 degrees for the dark.
Come on, stab it. Stab it.
So it's not quite ready yet. Let's leave the foil off so the turkey can get a nice layer of browning on it. I've got to get back to my guests.
Oh, sorry.
Here he is, all nice and brown and ready for carving. First, cut here in this thin layer of skin that holds the thigh to the breast. Cut all the way down to your carving surface and stop when you reach the joint. Great. Now just take your hand, washed of course, and press down on the thigh. Remove it when you hear the socket pop. Then just cut it off. Put that on a separate plate to carve up later. Now let's begin carving the breast.
No.
Nice and clean. Ought to have you over to carve our Christmas turkey too.
No, you
Let's
won't.
cut a few more slices. These guests are getting hungry.
Then why don't you do it? By the time you told me what to do, you could have done it yourself. Yeah. Cut it. Come on.
Wow, those are some delicious looking slices. Great job. Let's just go ahead and eat. See you after dinner.
Bye, Jeff. Nice.
Our subject is, well, gone, but everyone else is recovering nicely. They'll want to rest thoroughly to let their food digest. Guys might need to loosen their belts a few notches for comfort. Your guests may also stray into the kitchen for leftovers. That's normal and encouraged. It means less you have to clean up. You did a great job today. Thanks for your help in the kitchen. Have a wonderful Thanksgiving, and we'll see you back in the OR working on one of our other surgeries here at surgerysquad.com.
Alright guys, I'm Princess Ricky. If you like this video, don't forget to like, comment, subscribe, follow me on Twitter and Facebook and Snapchat at princess_Ricky1, and I'll see you in the next video.